All right, awesome. Well, hello everyone. This is our guide to breathing easier. It's essentially a video about how you can try to practice some breathing exercises, learn a bit about your lung health, and other ways that you can improve your breathing if you experience shortness of breath in your daily life. So just to provide a little bit of an introduction, today we are joined by Bethel and myself, Winnie. So here's just a little introduction about who we are.
Yes, so I'm in my third year of health sci, and a fun breathing related fact for me is that I really enjoy the smell right after it rains. I think the word for this is petrichor, and I also love the smell of my mom's Ethiopian food.
So wholesome. My name is Winnie. I just graduated from health science as well from McMaster. Similar to Bethel, I am a certified breather of 2 decades, and if I could breathe any kind of air, I think it would be the delicious stuff that is wafting off of fresh baked cookies. All right, and just some of our plans for today. So we're covering quite a lot, so brace yourselves. This is going to be fantastic. First, we'll be talking a bit about the physical changes that'll be occurring in your respiratory system as you age. Then we'll be talking about how you can protect your lungs from lung damage. And then lastly, we'll touch a bit upon exercise and diet, including light exercises that you can do from home, and how you can watch what you eat so that you can breathe better in the future.
Awesome. So, to preface, for most people, infrequent shortness of breath is totally not a reason to sound the alarm. But if you feel like this shortness of breath is keeping you from your daily activities, keeping you from maybe going to work and hang out with your children, then it may be time to call your doctor. So, experts recommend scheduling an appointment with your doctor if your shortness of breath is followed with swelling in your feet or your ankles, trouble breathing when you lie flat, really strong fever, chills, coughs, or wheezing. This could be signs of things like infection or COPD. So you should see a doctor if you notice shortness of breath becoming more and more severe as well. And if you feel anytime a strong pain accompanied with your shortness of breath and it's immediate and really strong, then it can be time to call 911 right away. Okay, so now to get into how the lung ages, we're going to be taking a more anatomical look, but it will be like a very simplified version and totally great for people without any biological background. So, in early life, the chest wall is relatively supple, and with age, there is a gradual increase in rib calcification, which means hardening. So these changes mean that the chest wall becomes more and more rigid and results in kind of a curvature of the spine, which is seen in many older patients. And then this progressively reduces the volume of the rib cage, which means the rib cage size gets smaller. Breathing becomes more labored and coughing reflex is less effective. So when you cough, it's harder to get stuff out of your breathing canal. And then there's an increased risk of respiratory tract infections. And then secondly, the respiratory system is extremely vulnerable to infection and damage from pollutants because it's warm, moist, the surface area is continuous with the outside environment, so it makes it great. The airway is a great place to start an infection. Furthermore, the ciliary escalator is used to clear pollutants. So when you cough because there's something in your lungs or something, that means you're trying to get it out, and this is using the ciliary escalator. So the activity of this escalator decreases with age. So researchers examined individuals from 19 to 81 years old and demonstrated a clear decline in the clearance of particles that were inhaled. This may be related to the decreased number of cilia in your airway or also the decreased function of the ciliary escalator. But no matter what it is, there is a higher chance of infection and of lung disease being occurring in people of older age. So yeah, RTI means respiratory tract infections, by the way. And then alveoli. So the loss of elasticity in lung tissue and airways leads to progressive increase in the diameter of respiratory alveoli and bronchioles. So basically bronchioles are and alveoli, so alveoli are on on the bronchioles and it gets progressively smaller and smaller. You can look at it with a magnifying glass, but that's basically where the gas exchange happens. So when you breathe, you release carbon dioxide, you take in oxygen from the outside, and that change in gas, so the gas exchange happens at the alveoli. There's many alveoli in your lung. That you need so many because you need lots of surface area in order for this gas exchange to happen fast. And let's say you're running, you need more of it, then it happens even faster, and this is all because of the amount of incredible surface area located in your lungs. So over time, these structures widen and reduce the depth of the alveoli. The alveolar walls can even start to disintegrate, which means the surface area gets less. And the air sacs also start to flatten, which means like overall the surface area located on the lungs decreases, which means gas exchange cannot happen as efficiently and effectively, making it hard to breathe for older patients. Awesome. So now if you've been to the clinic, you've probably had a spirometer used by a doctor when they've been assessing you. So you may have heard many acronyms like RV or VC being thrown around, and this is what some of them mean because they are really important to breathing. So residual volume, or RV, is the air remaining in the lungs after a full forced expiration. So breathe out really hard, and that's your residual volume. Like you can still breathe out a little bit more. So it's normally at 1.2 liters at age 25, and it gradually increases due to lung elasticity as you age. So the fact that it's increasing is actually a bad thing because you want to be able to breathe out as much as possible. But as people age, their lungs are not able to breathe out as much as possible, which means the residual volume is a little more than normal. Secondly, vital capacity, or VC as you might have heard around the clinic, is the total volume of air that can be exhaled after a full inspiration. So you breathe in really deeply and then that's how much you release. So that's your vital capacity. It's kind of like the working amount that you're using of air, just like when you're normally breathing. In an average man aged 25, it's around 5 liters, but this decreases to around 3.9 liters at 65 years old. So essentially, the amount that you can exhale after a big breath decreases as you age. In women, it decreases from around 3.5 liters to 2.8 liters, and these reductions are primarily due to the gradual increase in chest wall rigidity that we were talking about earlier, so the calcification and the hardening of the chest wall, and the loss of respiratory muscle as you age. And then oxygen capacity is, so age-related changes to the respiratory tract ultimately result in a reduced delivery of oxygen to the blood, and therefore decreased oxygen saturation in the blood, which means you have a lower amount of working oxygen, so it's just harder to, like, you'll need to breathe more in order to get the same amount of oxygen as you did maybe 20 years ago. Okay, and lung parenchyma, just to look at the lungs a little closer, is the portion of the lung that is involved in gas transfer. So this is the alveoli, the alveolar ducts, and respiratory bronchioles. That's essentially what they look like. So this is what we've been talking about, and we need a great surface area in these in order for gas exchange to be efficient.
Let me see if I can use a pointer, actually. Could you talk about the difference between this young adult lung and the older 100-year-old lung?
Yes, excellent point, Winnie. So as you can clearly see in the left one, there is definitely more lines and zigzags, and so you can tell that the tissue has more surface area in the parenchyma, which means that this oxygen to carbon dioxide switcheroo that it does can happen more effectively. But in the 100-year-old lung, you can see that there isn't as much tissue, therefore there isn't as much like physical space for this gas exchange to even occur, which means that the gas exchange occurs less effectively, less efficiently, and it is harder for the patient to breathe.
Okay, and what are we looking at here on the right?
This is just a physical version of the parenchyma. I want to give everyone an actual tissue picture instead of just these kind of not realistic lines on the left.
Oh, okay. I thought because of the darker spots, it might have actually been like a smoker's lung or something like that, because I know you can definitely see the pigments in a smoker's lung.
Mm-hmm. Yes, for sure. I think, yeah, this lung might actually be that of a smoker, but it definitely can get more worse than these pictures. So this is kind of to lead into the next section of how to prevent and how to intervene. So lung function decline with age versus COPD. So the earlier that you can intervene on COPD and I guess other lung diseases, with the longer a patient can live. So this chart just emphasizes the importance of being aware of if you have shortness of breath and being like and sending yourself to a doctor essentially to intervene and to prevent decline.
Okay, so in the dark is if you don't have any intervention, essentially, your life expectancy is about here is what
Yes.
I'm seeing versus, let's say, early intervention. You figure out early on and you're able to live much longer as a result.
Yes, exactly. And the same theory applies to other medical issues like cancer. So earlier intervention, earlier prevention is always better for anything. Exactly. Also, for prevention, if you have been a smoker in the past or if you currently smoke, it's never too late to start preventing. So the faster you can quit, you'll still see benefits in the future. Awesome. So some preventative actions include stop smoking. It's a major cause of lung cancer and COPD, which is chronic obstructive pulmonary disease, and this includes like bronchitis and emphysema. It can just make your life quality overall much easier to breathe. And yes, it's never too late to quit is essentially the message we want to give you here.
Shout out to a future video.
Yes, pretty much.
Yeah, like keep an eye out. We're gonna have some smoking cessation videos coming out soon, so keep your eyes peeled on our YouTube channel. Yes. Sorry, carry on, Bethel.
No worries, that's perfect. Great shout out. And then some other indoor and outdoor pollutants other than smoking, so secondhand smoking, living in really high polluted cities, maybe using an air filter inside your house can all help reduce the risk of lung disease. And then thirdly, so preventing infection risk, especially as you age, is really important because infections and flus really harm the elderly more than they do the young, as you've probably seen with all the statistics of COVID-19. But it's important to take your flu vaccine every year. Wash your hands. Like if you're like wear a mask, especially now with COVID-19. But make sure to try to make yourself as safe from infection risk as possible. And then fourthly, Winnie will definitely go into way more detail about this. But exercising and diet can do so many benefits for the human body, especially the lungs. And then lastly, going to see your doctor consistently, going on checkups, because they might be able to catch something, like they might be able to catch your COPD before it gets too bad, things like that. Preventing and intervening.
Mm-hmm.
Mm-hmm. So prevention, we just talked about like physical things that you can do to help you stop from getting like lung diseases, but these are more warning signs of lung disease. So firstly would be chronic cough. Let's say you can't, some of these are also signs of COVID-19. So either way, it is important to go to the doctor and get checked. I'm just realizing that now.
Okay, maybe don't go to the doctor if you have
So if you have
COVID-19. Just go for a checkout. Go for a test at your nearest hospital or wherever the center may be, but don't interact with the public.
Yes. Thank you for clarifying.
Sorry.
But yeah, if
Go
you
ahead.
have a chronic cough, shortness, it's totally needed. If you have chronic cough, shortness of breath, wheezing, chronic chest pain, coughing up blood, anything that you think that you personally feel out of normal for you, for your lungs, for your breathing state, it's important to go to the doctor. If you feel like these are COVID-19 symptoms, as Winnie was saying, go get tested, avoid all contact with the general public. Yep.
All right, so Bethel was talking a lot about how exercise and diet can have beneficial impact on your breathing capabilities, so we're just going to expand upon that a bit. I feel like everywhere you go when it comes to health, everyone always talks about exercise and diet, so when I think about them, they're kind of like the golden duo that everyone refers to, but there's a reason that people stress upon them so much, and we're going to jump into that a bit. So specifically for breathing, diet and exercise can play interesting roles because they have specific functions. So we're going to dive into each of these little topics a bit more. But for diet, there's some research that shows that certain foods may actually improve lung health. But more importantly, diet is a way for you to lose weight or gain weight, depending on your current weight. Both losing weight and gaining weight, maintaining a healthy body weight, I suppose, is essential for ensuring that your body has healthy metabolism and is getting the energy it needs, and that includes the energy needed to breathe efficiently. But specifically for weight loss, it is beneficial because you'll have less fat in your chest wall, in your abdominal and thoracic cavities, which essentially gives your lungs more room in there to stretch out when you breathe. And that means easier breathing because there's nothing compressing your lungs and preventing them from expanding fully. On the other hand, when it comes to exercise, you're able to strengthen the muscles that are able to help with breathing. And when you exercise, you tend to breathe harder, right? Which can be difficult if you tend to get short of breath easily. But mild exertion, getting your heart rate up, all of that, it helps increase your lung capacity a bit more. And that means there's more air entering your lungs and therefore more oxygen getting into your body. And essentially it trains your lungs to work a bit harder and get better at breathing. Okay, so looking into exercise specifically, exercise has a lot of additional benefits, including what we just mentioned before, which was weight loss, strengthening muscles, and increasing lung capacity. But it also increases circulation and it increases the oxygen use in your body. It also reduces stress and anxiety, which could tie into breathing actually, because a lot of people tend to get short of breath when they are stressed. It also improves your self-esteem and you get better sleep and more energy. And all of these can contribute to your overall well-being, right? And also allow you to breathe a bit better if you just feel healthier overall. Okay, some top 6 exercises. There are so many more, but I think one of the biggest problems that we get is when you're feeling short of breath, obviously you're thinking, there's no way I can exercise. It's just going to make it worse, right? I'm not going to be able to breathe as well. And that's true, but that doesn't mean you can't exercise at all. So here are 6 awesome exercises that are good if you have difficulty breathing when you exercise. So obviously there's walking. I'm gonna list that as a no-brainer. Feel free to walk around. But also weights. People kind of look at weights as something intimidating that is only done in the gym by those big bulky guys. But in actuality, you could purchase, a cheap set of dumbbells from your local Canadian Tire or something like that, and just do a couple of exercises. There are a lot of videos out there, a lot of websites that teach you little exercises you can do, bicep curls, squats, just little things that don't actually get you breathing that hard, but help you burn calories and strengthen muscles, including those muscles that help you breathe. So this is an excellent source of exercise if you'd like to explore it. Secondly, there's yoga. Yoga is very relaxing, also helps you stretch out your body, and it's just a very gentle way to exercise, very enjoyable. You can feel free to try it out. There are a lot of beginner apps actually. If you have a phone, you can access an app store and download some yoga apps which give you some nice walkthroughs and helpful videos of yoga routines. So feel free to try that out. Something else is swimming. Swimming may be a bit difficult during the COVID-19 pandemic currently. But I don't know. I think that local swimming pools may be opening up. They may have. I actually don't know, Bethel. Have you heard anything about swimming pools lately?
I have no idea, unfortunately.
My guess is that they might start opening independent lanes or something like that. I don't know if it's possible to have social distanced classes where people can do water Pilates and stuff like that. I don't know. I wouldn't underestimate the
I have
the
no
public.
idea. Yeah, if it transfers through the water, if you can.
Mm-hmm.
No, I said I have no idea if infection can transfer through the water, so can people even swim together at the same time?
Yeah, I don't know.
Moment right
now. Okay, we're putting that in the gray zone, okay? Stay safe out there, you guys.
Yeah.
But if it were a normal everyday life, swimming would be a fantastic way to exercise because it puts less stress on your joints. I know a lot of y'all have arthritis, so it's a great way to exercise without hurting yourself or getting too out of breath. Okay, next one is, interval exercise. So this is a bit lesser known, but I include that little diagram there just to explain exactly what interval exercise involves. So essentially, it's where you have like a little routine, typically like where you have a nice warm-up, couple stretches, then you do something that's like very intense, like running at maximal effort, apparently, or doing a lot of jumping jacks, something big, just briefly though, 30 seconds, 1 minute, okay? And then you slow it down to a jog or a walk to get your heart rate to decrease, and then you cool down and relax for a couple of minutes, and then you repeat it a couple of times. So I know that when I have asthma, if I have to jog flat out for 5 minutes, then I'm a wheezing mess immediately. But if I jog for a minute and then take a break, then I'm able to go for a full half hour. So for those of you who get short of breath only after a period of time, this is a nice way to exercise and burn a lot of calories, if you're able to do so. Okay, something else, hiking. Before it gets cold and while the fall foliage looks beautiful, hiking is a fantastic way to enjoy nature, and just walk and enjoy and exercise a bit. It's a nice social activity if you're able to get together with some family and head out and just enjoy. I know a lot of our audience may be from Hamilton. If Hamilton has beautiful trails, I'm so jealous. Currently in the GTA, and there are so many buildings. So take advantage of nature and help it be your exercise buddy while you still can. Okay, and lastly, biking. What can I say? Biking is just very affordable. You are socially distanced from everyone, and it's still warm enough to be able to do so out there right now. So these are kind of, I shouldn't say top 6 exercises, just some examples of exercises that you can try out if you tend to get short of breath. Now, overall, here are some tips for exercising if you do tend to get short of breath, and they apply to any kind of exercise out there. First off, remember to warm up before you exercise and also cool down after, just to give your body a bit of a break to adjust to the exercise, I guess, so that you don't start running full tilt at the beginning, because that'll probably be very uncomfortable for you and your lungs. So try giving a warm-up, just a couple of stretches, a little bit of a jog. Bethel, do you work out?
No, I mean, sometimes, but I was going to mention stretching is super important. You don't want to tear any of your muscles, and it's especially like healing rate is also slower as one ages. So as Winnie was saying, stretching is super important.
Okay, also we're kind of approaching, I don't want to say we're approaching winter, that's kind of jumping the gun. It's getting colder basically. So if necessary, you can wear a scarf or a mask over your face. If you're around people, obviously, please wear a mask to keep yourself and others safe. But also, it might help you exercise easier because it'll keep warm air and moist air closer to you, which will be better for your lungs compared to breathing in like really dry air during the winter. Make sure to exercise indoors during allergy season, like during the spring or during the summer when there's a lot of grass dander flying around and stuff. Note it says still exercise. Don't give yourself a free break during allergy season, which is what I did, because you're probably not going to start exercising again afterwards. It's hard to break bad habits, so keep at it, okay? Try to walk around indoors or go to a local gym and socially distance. Or just wear a lot of masks and take allergy medication. So there are ways to work around it, and we believe in you to try to do so. Always remember to have your emergency inhaler with you. Bring it in a fanny pack in your pocket. But you just never know when you're exercising, because exercise does exacerbate shortness of breath. So make sure you always have the medication you need. And lastly, take breaks as needed. You guys are not superhumans. Don't push yourself beyond your limit and permanently break something, okay? Make sure to take breaks and then start exercising again after your break, and do it like with interval training, where you have intense exercise and then break and then repeat, okay? All right, moving on to diet. Like I said earlier, there are certain foods that may improve lung health, and here's just one nice academic review that was done by a couple of authors nice researchers who showed some relationships between certain diets and your lung health. So Bethel was talking about exhalation volume earlier. I think it was, what was it again? Residual volume? Residual volume, I think, was what you were talking about. Right. So if you have a greater exhalation volume, that means you have a smaller residual volume, which, like Bethel said earlier, is actually better for you. It means your lungs are able to exhale air a lot better. And what these scientists found is that vitamin E, D, C, A, as well as carotenes are correlated with a greater exhalation volume, which you can kind of interpret as potentially better lung health. And a lot of these vitamins and these carotenes are found in fruits, vegetables, fish, and whole grains. And these, in turn, are correlated with the decreased development of COPD and COPD mortality. So not only is it that you're less likely to worsen or develop COPD, but if you do have COPD already, so bronchitis, emphysema, other lung diseases, then you're less likely to have that worsen your quality of life in the future. Okay, so diet does play a big role. On the flip side, they did actually find that eating more refined food, so processed food, junk food, especially like all the packaged stuff you find in the supermarket, it is correlated with decreased exhalation volume. It should actually say decreased accelerated exhalation volume, because the more of this stuff that you ate, the steeper the correlation was. So the more of you eat, the greater or the less your exhalation volume is actually, which means the poorer your lung health is likely to be. So keep that in mind, okay? You are what you eat all over again. So keep in mind what you put into yourself, because that will actually make a huge impact on your health, okay? Invest in yourself, please. Okay, so some general diet tips. Remember, try to eat more complex carbohydrates. Here's a nice diagram just illustrating the difference between complex carbs and simple carbs. Complex, you see a lot of whole grains, oatmeal, vegetables, and fruit, versus simple carbs, basically just plain sugar, things that contain sugar, or just white flour. Try to switch them out. You can think of a lot of substitutions, and for those, feel free to check out some of our other webinars on our channel, because I think there are a couple of other volunteers who talk a bit about diet and some handy substitutions you can make that won't break your bank. Okay, I already said avoid processed refined foods. Fats get like a mixed rep, so unsaturated fats such as those in liquid oils, those are okay in moderation. So other examples, nuts, avocado, those are okay. Just try to avoid solid fats like essentially fried foods, butter. Those are saturated fats, and those are not as good. So unsaturated, okay. Saturated, less okay. All right? Another tip that some people find really works for them is just having more small meals or snacks throughout the day rather than having the typical breakfast, lunch, dinner meals where you're more likely to overeat because you're so hungry in between. And also remember to drink lots of water. If you drink, I heard this is like one of those cheats that I heard and that my parents always tell me to do. If you drink like a glass of water before your meals, it'll like fill in volume in your stomach and you're less likely to eat too much food during your meal. I think it kind of works actually. Bethel, have you ever tried something like that?
Yeah, at buffets, I try to limit my amount of water that I take in, so I'm sure the opposite will work.
Okay, and just to end on a bit of a nice quote from Jillian Michaels, remember, it's not about perfect, it's about effort. And when you bring that effort every single day, that's where transformation happens. So if you were watching this and you saw a couple of things that you want to try implementing, that might be some exercises, some dietary changes, or even just education, wanting to learn more, you can do it. Just put in the effort regularly, keep grinding, and best of luck. Okay, so this is the part of the video where we try to get everyone to start thinking whether or not there's a plan you want to implement. So was there a particular goal that struck you throughout the video, or is there something in your personal life that you just want to accomplish? Okay, so let's try to follow the SMART goal format. So S stands for specific, M, measurable. You want to use things that along the path that'll help you determine whether or not you're actually meeting your goal. You have to make sure it's achievable and realistic, so be reasonable. You're not going to look like, I don't know, what's some really like hulky or super fit person that's out there these days? I'm incredibly out of touch with culture. Let's just go with the Hulk. You're not going to look like the Hulk from the Avengers, okay? Or you can, but don't push yourself and say that you're going to look like the Hulk in like 3 months' time, because nobody's going to do that, including the actual actor, because they had to use CGI. Okay, anyway, lastly, make sure your goal is timely. So give yourself a set amount of time to accomplish the goal and set a deadline. So hold yourself accountable, okay? So here's just an example. I tried to match up the color to the SMART acronym on the left. So for example, I am going to bike every single day or 3 days out of the week, and state the particular days you want to accomplish this goal. I'm going to bike specifically for maybe 1 hour, 60 minutes, okay? And in order to hold myself accountable, I'm going to have a chat with my sister every single day and make notes in my journal or use an app, or I'm going to vlog it using a voice recording on my phone or an old tape cassette, and just keep track of my progress in order to make sure it's realistic, achievable, and measurable, and timely. Wow, we're tackling a lot of these here. You can specify, maybe I want to lose specifically 5 pounds. Specify the number of pounds and by what date, and make sure that it's reasonable. And also, I just tagged this in myself, I think it's important to remember to reward yourself at the end of the day. Like, a lot of the time we accomplish a goal and then we move on immediately to the next important thing in our life, and we forget to reward ourselves for the previous achievement that we had. So if you do enjoy movies, if you enjoy art, music, spending time with your family, make sure to reward yourself fully and enjoy it after you accomplish this goal. Okay? All right, and lastly here, just a couple of more resources for support and information. If you're like a social personality and you find that you kind of enjoyed this video, you enjoyed having people present information to you in sort of a webinar style, or you like socializing with others more directly, not like this. I think a lot of these organizations do have support groups and such. So here in Canada, Ontario doesn't specifically have a Better Breathers Club, but I'm sure you can join Alberta or British Columbia's, and they're going to welcome you. Fantastic people, where they have weekly virtual seminars and activities and discussions. You can also feel free to join the American Lung Association's Better Breathers Club, so that's from the US, but they also have a lot of online meetings on topics like maintaining lung disease management, and they have a lot of COVID-19 specific webinars if you're interested in learning more about that. Okay, so feel free to check those out, and also remember that you can contact us if you require more support. There we go. That is our contact information there at the end. Email us at drkearney.com. What am I saying? That's that's the website. Email us at drkearney232@gmail.com. There we go. Bethel, anything to add before we end off the video?
Nothing much to add. Hope everyone enjoyed that.
Yep. All right. So remember to please take care of yourselves, take care of your lungs, and we are rooting for you. Okay. Whatever goals you set, feel free to update us about them, and we will check in with you at your next appointments, or just email us with any questions, and we'd be happy to be of support. All right. Take care. Bye bye.